The last cough out.
Hey guys, welcome back to another episode of The Last Zebra. I'm your host, Ugo Ezama. As always, please don't forget to like, share, subscribe, and comment. Today we have Dr. Sam Karlin. Welcome to the show.
Hi, I'm so happy to be here.
Thank you. We've been trying to get you here for a few months now. But of course, you had some much more important things to take care of.
Just a baby.
Just a baby. Tell us a little bit about yourself.
So thanks for having me. Excited to be here.
Absolutely.
I wish I could get here earlier, but I had a baby 5 months ago. That's probably my most exciting update. And she is adorable and cute and sweet and the best ever. So life is good. I'm from New Orleans originally. Grew up here besides a little brief time that we were in Houston after Hurricane Katrina. Then ended up going to college at University of Georgia, go Dogs in Athens. And that was great.
Wow.
Came straight back for medical school at LSU in New Orleans. So that was nice to be back home. And then ended up doing my dermatology residency in Charleston, South Carolina. And so for dermatology residency, you have to first do a year of internal medicine, ICU, and that's where I met Ugo, which is great. So I did that at Tulane, and then the last 3 years were in Charleston. So I was there with my husband. We ended up getting married during that time and trying to figure out where we're going to go after that. And we ended up moving back to Louisiana 2 years ago, which has been great to be around, family and friends and things like that. We made the jump to the North Shore. So we're in the burbs now, but loving it and life is good. I'm in a group private practice over in Covington right now. So it's me and 3 other dermatologists and a nurse practitioner and some estheticians, and I love it. Everybody's great. I love going to work every day. So it's been a really good past few years.
That's beautiful. Yeah. That's beautiful. When were you sure that you wanted to be a doctor?
Oh, I feel like looking back, there was a long period of time where I really, really did not want to be a doctor, actually, really? Because my dad and actually my grandfather, his dad, they are and were both general surgeons. And so growing up, I saw my dad just miss all of my soccer games and the school plays and he was working a lot, and those hours were a lot. So for a long time, I think I was kind of like, I definitely don't want that lifestyle. Right. Like there's just no way. And I just also didn't really know that there could be another lifestyle like dermatology, which is great. But I think it was when I was in high school, actually, that my dad ended up getting diagnosed with colon cancer and he's doing great now. But at the time, I feel like that was kind of my first introduction into medicine a little bit. Just kind of seeing him, I had seen him as a doctor, now seeing him as a patient. And I think at that time I realized that I really wanted to, be in medicine and maybe do something along the lines of cancer prevention in some sort of way.
Really? So this was in high school.
Yeah.
What were you planning on doing prior to that experience?
I know. I don't know if I really knew. I think at some point I was thinking about like journalism, which now to me, I don't, it just seems funny to me. Before that, I wanted to be an astronaut. There was a really long time that I wanted to be an astronaut, like would write to the astronauts that were around, wrote to the first female astronaut, or maybe she was the first woman that went into space, but, and she wrote me back and I had her picture on my wall. It was a whole thing. All my birthday parties were space themed. So there was a long time that I wanted to be an astronaut. So I kind of pivoted from that a little bit.
You could still be an astronaut. I also want to be an astronaut, and I'm saying that in present tense.
Oh, okay.
I'm not sure how, but there are pathways for professionals, as to
Yeah.
kind of like find their way into astronaut. I'm
Definitely.
probably getting too old to actually even do any such thing. So, you might still have a
It
chance.
might be in there. I actually did just read an article that they are looking to train doctors, or they're trying to train, I guess, medical students now, but to have doctors that can go into space, since they're sending up more people and people are going to be in space for longer.
Absolutely.
So, I mean, the opportunity is there.
There's probably space for astrodermatology.
Yeah, space for it.
You could
Boom.
So once this happened, your dad's colon cancer, and you experienced him as a patient, and it sounds like it gave you a very different perspective of what medicine could be like. What did you pick up from that experience that really shifted that perspective for you?
Yeah, I feel like just kind of seeing how vulnerable the patients are, or just as a patient, how vulnerable you can feel, and how vulnerable the family can feel, and how certain people that were around during that time really made the experience a lot better than others, and just kind of seeing it from that perspective a little bit. And so then I realized that, okay, I would love to maybe kind of make this experience, better in some ways for some families, or kind of keep up some of the things that I saw were happening around that time that made everybody feel just like safe, and, make everybody feel like optimistic and things like that.
Did you do pre-med in undergrad?
I did.
Did you, looking back now, how do you feel about pre-med as your college journey?
Yeah, I mean, I'm happy now because it allowed me to go straight from college to medical school, which I know, for a lot of people, that's not feasible. Or, if you kind of decide later, maybe in college, that you may want to do medicine, then you may have to do some extra classes and things like that. But I thought it was good. I will say it was definitely an eye-opening experience going from high school to college and just going straight into the pre-med track. I also started as a physics major because I was really into that at one point, but I switched to biology and psychology is what I ended up majoring in, both of those. But yeah, I think that the first year was a little eye-opening. But then once I kind of got my bearings, I realized that that's something that I did definitely want to do, which is good.
You mentioned you did your undergrad in Georgia. Huge school, massive school. What was that transition like, coming from New Orleans to such a, just a gargantuan college experience?
I know. Right. I do feel like New Orleans feels like such a small town.
Yeah.
And then growing up too, I went to small schools here in New Orleans. And so I think I graduated with like 50 people.
Wow.
So definitely going from that to Georgia, which is like 30,000 people or something, it was a big difference. But I really liked it because I felt like there's a lot of different people to get to know and a lot of different groups. And I did feel like it's felt smaller, getting into certain things. Like I was in a sorority, so I feel like I, got to know a lot of people through that. I was in the honors college, so a lot of my classes were a little bit smaller too. So it was nice to kind of find like different groups of people, and then, a lot of different groups of people. Because I feel like, where I was going to school, there weren't that many like different groups of people. So it was great. I really liked it actually. And I feel like, too, when I was saying how I went to Houston for Hurricane Katrina for like 5 months, at that time I did go to a bigger school where there was like 550 people in the class rather than 50. And so I kind of went back to that and I was like, okay, that was kind of fun, maybe not, the circumstances not so fun, but it was kind of fun getting to know a lot of different people and just having a lot of people there that you can kind of talk to. So I was really glad I did it. Like looking back, I was really happy that I went to a big school.
What was your process of either elimination or by pros and cons that you came to decide to be a dermatologist? So what was your first, I find that often people go into medical school with an idea of the specialty they want to be in, but they end
Sure.
up not doing that.
Yeah, yeah.
Just through the exposures that you kind of encounter throughout the entire medical education process. What was your process like?
So I went in thinking I'm not really sure exactly what I wanted to do. I thought maybe I wanted to do some cancer prevention kind of thing. So in my head, I thought pediatric oncologist.
Wow.
That was just kind of like where my brain went to. But then I also had a couple wrist injuries and went to an orthopedic surgeon. And so I was like, oh, I could be a hand surgeon. It wasn't all orthopedics, it was just hands. That was all I was interested in. But I think I realized I really didn't know a lot about what each specialty actually does. And I didn't even know that some specialties, even existed actually. Like I didn't know that PM&R existed until medical school at all.
That's true.
And so going into it, I just kept a really open mind. I didn't ever really go to the dermatologist a lot growing up. So I really had no idea what they did. I mean, I knew acne or that was about it, but I didn't really understand exactly what dermatologists did growing up. So going into medical school, kept a really open mind. And then I went into my third year rotations and I had dermatology at the very end because I thought I may be interested. So I had that on there and had the core rotations before that. And I remember the very first rotation, one of the residents telling me, like, imagine yourself doing the most mundane part of each specialty all day for the rest of your life. And if you still love it, then that's the specialty for you. So I thought that was actually really good advice because I was sitting there, I was like, right. I started off on labor and delivery and I was like, wow, birth is beautiful. Like, this is so amazing. Look how happy everybody is here and everything. But then, kind of went through the OB/GYN rotation and I was like, oh, okay. I see what he was saying now. Okay. If I had to do pap smears all day, every day for the rest of my life, would I enjoy that? So it was actually a really good mindset to have for the rest of the year. And then I started to realize that I didn't really love anything at that point at the end. And actually made me really worried because I had all these friends who were like, I love everything. I don't know how I'm going to pick. And I think a lot of people do feel like that in medical school, which is great.
Yeah.
But I was kind of the opposite where I was like, I really did not love everything. I thought things were fine, but I didn't really find my passion. I was really nervous and scared about that. And then my very last rotation was dermatology. And I was like, oh, thank God. This is it. So, I think the biggest thing with derm that I realized is just there's so much variation in what a dermatologist does all day, every day, which is really nice because I get bored easily. So it was great that every day is different. We do a lot of procedures, a lot of medicine, a lot of medical dermatology, can do cosmetics. I'll do cosmetics too. So it's just every patient is different. The order is different. No day is the same. And to me, I really like that. And then I really like the cancer prevention aspect of it too. And that's kind of where I could kind of tie that back in a little bit with skin cancer prevention, because that's probably the bulk of what I do every day is, treating, either skin cancer, skin checks and things like that for prevention, or diagnosing skin cancer, or then excising skin cancers and things like that. So that's kind of how I looked at it. I also, really, really liked that I could see kids through adults because there's not a ton of specialties now where you can do that.
That's
a lot of times you have to kind of pick one or the other. So I really like that I can do that. And then I see a lot of families, so that's nice too. There's a lot of continuation of care, which, just continuity in general, which I really like too. So I get to hear about, people's grandkids and their graduations that they're going to and their family vacations. And so I just feel just personally connected to a lot of my patients, which I really like.
At what point from that third year rotation to, I would say, through to residency, did you find that passion for dermatology?
Yeah. I think while I was still in med school, that fourth year where you do a lot of rotations in your specialty, I realized that I was like, okay, good. I picked right. This is what I want to do. I really want to do this. And I'm sure I could have been happy doing something else, if it didn't work out. But I was just so thankful that it did because, I just realized I was like, this is it. This has, kind of checked all the boxes that I thought I might like, but then actually kind of seeing people practice dermatology, I realized that that's what I really wanted to do. So,
and dermatology is insanely competitive, at least from what I remember. I think some people, I have friends that just automatically took it out of their like list because like, you know, it's way too competitive.
yeah.
There are a lot of reductive. I will bash myself in this too. We have a lot of reductive understanding of what a dermatologist does. First, my first question in that regard is, what are the mundane parts?
Yeah.
That, you know, on a day-to-day basis that does kind of, you know, make up your day that you still get to enjoy? And then what are common misconceptions that one, the general public have about dermatology and dermatologists and your colleagues, us physicians, nurse practitioners, PAs, other providers? What are some of the misconceptions that we may have? So I guess a 3-part question.
Yeah. Okay. So the first part, the most mundane aspects, I do think probably doing a lot of, so probably the skin checks or like the acne too, like some of the mild acne like that. We have a ton of patients that come for acne and for skin checks. And you know, they're both really important in different ways. But that is something that is just a little more repetitive. But you know, still really enjoyable. Because even if you do a skin check, you don't necessarily like find anything. One, that's a good thing for a patient.
Right,
so you can
right.
say, okay, you're good. Like that's a good thing, you know, and can counsel on like prevention and, you know, have some time to do that. And also just kind of as we're checking can just like catch up on, you know, how are they as a person, like what's going on. So it still is enjoyable in those ways. And I mean, acne, I mean, even though we see so much of acne, so sometimes it can feel a little repetitive. It's like, okay, another acne patient. I mean, acne can do so much to somebody's self-esteem. And so it's really, really interesting to see somebody at their first visit and then, you know, later on, maybe once their acne is completely cleared up, because a lot of times the person's completely different, which is really interesting. Just, you know, it's just something that we just kind of think of like, oh, it's just acne, but it really, really affects a lot of people. So to me, that's really enjoyable too, just to kind of like see that process a little bit. And then I feel like as far as the misconceptions from the general public, I think that was part 2 of it. Yeah, I mean, I do feel like a lot of times it's like, oh, dermatologists just like pop pimples, right? That's something. And like, you know, Dr. Pimple Popper, for example.
I'm sure that didn't help. Yeah.
Yeah, like people love Dr. Pimple Popper, which is great. And you know, it's funny. I met her when I was in like my chief resident year of residency. We were both presenting at the same conference. She was like the nicest person ever, literally so sweet. Like FaceTime my cousin who's obsessed with her, like together so that he could see her. It was this
amazing.
whole thing. But I remember she was telling me like, so she's actually a Mohs surgeon, which is a dermatologist who did an extra fellowship to do Mohs micrographic surgery, which is skin cancer surgery that's usually kind of in this face area. And the reason why we send a lot of patients to Mohs, or if I see a skin cancer in that area, I send them to Mohs, is because they have a lab in their office so that they can take just a tiny little margin around what's visible and can actually check the margins 100% in the office before kind of continuing either to excise it or the repair, so that you know that all the margins are clear, versus like our standard excisions where we have to take a standard margin, kind of send it off and wait, and there's a chance that there could be you know, there could be some residual or, you know, especially in areas like the face, we don't have a lot of real estate there to kind of take those margins. So it can be really nice for patients to not have this like huge cut. So she's actually a Mohs surgeon and she does these huge flaps and grafts. And I think like Mohs surgeons now do more flaps and grafts on the face than even the plastic surgeons do. So that's because that's all they're doing all day, every day. They're not doing any general dermatology. So she does that, you know, all the time. And so she was telling me though, for her show, they filmed like that stuff. And then they also filmed the pimple popping, the cysts popping, and the blackheads. And people just did not want to see the skin cancer stuff. Like that was gross. It was gory. But they love the pimple popping, which I get. Because if you look at some of those videos and like the blackhead extractions, like it's kind of like addicting a little bit, like just to kind of watch, and you're like, wow, it's, they all came out kind of thing. So I do think because of that, I think actually she brought a lot of exposure to dermatology, which is really good. But I also think because of that, a lot of just the public, the common perception is that like that's all we do. And if you don't have acne, you don't need to see a dermatologist.
Right.
But really, right, there's a lot of things we do. There's over like 3,000 skin, hair, and nails conditions that we'll diagnose and treat and manage. So that is one thing too. We do hair and nails. Some people don't realize that either. So skin, hair, and nails are all fall under dermatology. So if there's anything, going on with those, come on over. And that's probably something for kind of part 3 too, that I think sometimes other specialties don't really realize even that, as well. We also do the hair and nails part along with skin.
Yeah.
And there's a lot of like really common rashes, which we'll see and do, but there's also a lot of like even hospital dermatology that, dermatologists will help out people in the ICU that have graft versus host or, some sort of medication reaction or something like that. So I do think there's a lot that the public and even other specialties don't exactly really know about dermatology. And probably my last thing on that is that for the general public is that people should be getting their skin checked, because that is something that I feel like on social media now, there's a lot of misinformation out there and things like that. So that's something that we see in the clinic, just a lot of people with questions from that. But one thing that I always try to like tell people is that ignore anybody saying that you don't need to get a skin check. Like if you're an adult, you need to get a skin check once a year because it's just preventative care. It's just like you go to your, annual wellness check.
Right.
Everybody can get skin cancer. Darker skin can get skin cancer. We see it all the time. So that's like my one PSA is that get your skin checked once a year.
You actually answered what my next question was going to be, which was basically what is an often overlooked thing where skincare is concerned that you see that, or you have observed that the general public has no idea that they should be doing. And obviously getting your skin checked at least annually.
Yeah.
Anything else that you would add to that list?
I know. I think that's really the big one. And then also just sun protection in general is one too. Because I think a lot of people don't realize that you get a lot of sun just existing basically. Like even if you're not at the beach or the pool, you still get a lot of sun. We statistically see more skin cancers on the left side of the body because of driving, because the windows block UVB rays. So sunlight has a lot of different UV rays. They block UVB, and that's why you don't get burnt when you're in a car, but they don't block UVA. And so UVA rays are implicated in precancers and skin cancers and wrinkles and sunspots and all that stuff that we don't want. So that's one thing too, is that I would kind of add is especially like traveling, like, protect yourself, planes even. There's a study that came out like over the past few years that showed that pilots and crew members had a higher incidence of melanoma. And actually being in the cockpit for 1 hour of flying time was the equivalent of 20 minutes tanning bed UVA exposure.
What?
So I know. So that's another thing that, especially if you're a pilot or flight attendant, definitely get your skin checked. But, if just for the general public, like traveling, like that's something like wear your sunscreen on the plane, wear it in the car.
You mentioned some misconceptions that you've identified or you've, heard your patients bring up in their appointments with you from social media. What are some of the most frustrating ones that, you hear that, is I guess flat out wrong?
Yes. Oh man. I feel like, there's so many to pick from. I feel like the most recent one for me is that sunscreen causes skin cancer.
What?
That's something that I've heard a lot recently, actually. And people always pull from like certain graphs, at least on social media, if they're trying to make something, they pull from certain graphs that they're like, look, the incidence of skin cancer has been on the rise. People didn't used to wear sunscreen when, they were cavemen, and like, what happened to them? It's like, well, they died early. Like that's the answer, right?
Right.
People are living a lot longer now. And so the incidence of skin cancer and the prevalence of skin cancer are both going up due to better detection. I mean, that's one thing too. Prevalence going up just because people are living longer in general. And then also like, even when so there's another study that I read recently that kind of in the JAD, which is like the Journal of American Academy of Dermatology, which is like our big journal. But they looked at the incidence of melanoma and they basically accounted for all of these, these variables, I guess I'm saying, the reasons that the incidence of melanoma could be on the rise. And they found that even when you account for basically everything else, the incidence of melanoma is still higher now than it used to be, especially in young people. Even if you take out like tanning bed use and you take out a lot of these variables. So there's just more skin cancer now. And so I think some people took that as, well, people wear sunscreen now, or more people wear sunscreen now. So, there's a correlation. So maybe there must be causation, right? That's always
right.
But the correlation does not imply the causation.
That's right.
So no, that's something I always just have to kind of counsel people about, that, that's not the case. We know that the sun's rays are carcinogen and that can cause skin cancer. Sunscreen is to help block those so that, or protect yourself so that you won't get skin cancer. There's a whole thing right now between chemical sunscreens and mineral sunscreens, which for that, I mean, that's another really kind of common question that I get, which I do think it's valid. There's some reports that, are kind of suggesting that like for chemical sunscreens, like we may be kind of absorbing more of those into our bloodstream than we once thought. So I get the raise of the concern. However, when they really look at this, the amount of that sunscreen that's getting into the bloodstream is so low, to a point that we don't consider it to be to have like any sort of clinical effect
any
to
meaningful,
it. Right. A lot of it's coming from rat studies where they were, there's just a lot, you just can't generalize rats to humans.
Right.
But with that, I say, if there's any concern about chemical sunscreen, there's mineral sunscreen. So kind of the difference, chemical sunscreens get more absorbed into the skin to help absorb the UV light and dissipate it. Whereas the mineral sunscreens work a little bit more like physical barriers, where they don't get as much absorbed into the skin and they kind of sit on the skin to reflect the UV light. So the mineral sunscreen, so that's like zinc, titanium dioxide. If there's any question and people want to avoid the chemical sunscreens, I just tell them like, that's fine. Like do a mineral sunscreen. And that way, you don't have to worry and you're still getting protection. So
should I be wearing sunscreen every day?
Yes,
every day.
You should every day. So yeah.
I'm going to confess, in my entire life, I've probably worn sunscreen 3 times.
Yeah. I
Maybe
get it.
4.
I get it. And I totally get that. It's, the thing is, right, I feel like when people have naturally more melanin, darker skin, you don't get burnt, as often, really. So a lot of people think, oh, well, I don't really need sunscreen because I'm not getting sunburnt.
Right.
But I think that's just another common misconception, is that, it's not the burn necessarily. It's not just the burn that's kind of leading to skin cancers and things like that. It's cumulative sun damage over time. So the sun's actually damaging, our DNA at a cellular level. So that over time kind of compounds. And then at some point, the mutations get to a point where now cells are rapidly dividing and you get precancerous skin cancer. So we do recommend it. At least like, I think like the more feasible thing is like neck up, and then our hands, backs of the hands, or like our forearms if it's the summer, just in the morning. And then that way, if you're like going in and out a lot, you're not like really in the sun, you have some kind of like baseline protection. If you're at the beach or the pool, you're going to be outside for a long period of time. We say reapply every 2 hours. But it is worth doing. And just like to prevent wrinkles and sunspots and like the stuff that we don't want either, It's
good skincare to begin with.
Yeah.
maybe there are, but why are there no lotions that have sunscreen in them? I mean, it would make sense since most, or at least a lot of people use lotion on a day-to-day basis.
Yeah, for sure. So there are now, which is good. There are now. But you're right. There's not a lot of like body lotions, things that are marketed as a body lotion with a lot of sunscreen in it. So you're right about that. And I think that is like, it has to do with the way it's formulated and things like that. But for facial lotions, there are. So there's a lot of facial moisturizers now that will have, we'll say like facial lotion or like facial moisturizer with SPF, and then you want 30 or higher. And so those honestly are just so much better tolerated, and people like those a lot better because then they're not greasy, they don't smell bad. It just feels like a lotion, and most people put lotion or moisturizer on their skin anyway in the morning. And so that's what I tell people to kind of like start with and do. And then there's, tinted versions for people who want more of a tint. There's non-tinted versions if you want it to be more clear. And I do feel like sunscreens too have really gotten a lot better at making clear formulations, because that was always something too, right? No one wants white, opaque, like heavy sunscreen on that smells bad, any of that. So they've gotten a lot better. Like even in the past few years, I feel like the sunscreen formulations have gotten really, really good. So I always tell people, like, if you haven't found one that you like, there is one out there for you, but like keep looking, but don't just use that as like, oh, it's not for me. Like there are good ones out there.
Another thing, since we're on the topic of social media, is two things. When someone says, get ready with me, or this is my nighttime face, I don't know what it's called. Routine, a routine where you wash your face, you put this cream, you put that cream, you put this moisturizer, that, which I'll admit I've never done. Should I be doing that?
No, you really don't need to make it complicated.
Okay.
That is one thing too. I feel like we see a lot of younger people, like especially teenagers who have TikTok and things like that, seeing these videos of like, right, come get ready with me. I have a 20-step routine. And then they come in and they're like, I'm doing all these things. And it's like, it's just a little too much. You don't need to do all those. Especially teenage skin is really delicate. So you really don't have to. We see a lot of people who start breaking out and getting acne after they're adding a lot of these products in. Because sometimes too many things that individually may be fine, like too many can be irritating and can lead to skin barrier disruption and things like that. So no, I say you can actually keep it really simple, which is good. And another thing is too, is like, you don't really need super expensive skincare for the most part. Some products are a little bit better. Some products like vitamin C's tend to be a little bit better when, or they tend to be a little bit more expensive for the better ones. And that's mainly just comes from packaging, because it's really easy for vitamin C to be inactive or basically to oxidize. So it's really easy for that to happen. And then the product isn't active anymore.
Right.
So those tend to be a little bit more expensive, but all the other products like really don't need to be expensive. Just like gentle face wash, a moisturizer, sunscreen. And that's really all you really need to a certain degree. And then if you have other things that you're trying to address, like you're trying to age gracefully, or like, any lines under the eyes or anything like that. Like there are a lot of things for that too, which is good.
Are tanning beds the arch nemesis of dermatologists?
I think so. Yeah. I think tanning beds are like the smoking is to the pulmonologist. I do, for derm. And I will admit, I hate admitting this, but when I was in college, I went to the tanning bed a few times, probably more than a few times. I definitely went. And that was just before I really knew, at the time I knew, well, this is probably not great for me, but I didn't really know how bad it was.
Right.
And like since then, and, since becoming a dermatologist and, knowing a lot more, and also just being biased in the sense that I see people with skin cancer like every day.
Right.
We now know that just exposure to the tanning bed raises your risk of melanoma by 75 times. I mean, that's a really big statistic, right? If anything, if you said like, oh, if you do this, like it's going to raise your cancer risk by 75 times, like I probably would not have done it.
Is that dose dependent per dose?
So that was just one tanning bed session.
Wow.
Yeah, that statistic comes from a study. They just looked at one. So people who just had one exposure to people who did not, which is pretty amazing too. Because obviously we're always, people in general are always outside. So we're always getting some sunlight, but that's just, we know that the actual tanning bed sessions is just like really, really like the dose, right, is a lot higher of that UVA radiation mainly. So yeah, I would say if I could go back in time, like, whenever people are like, what is a big regret? Like, I don't have a lot of regrets, but that is a regret of mine.
Is using the tanning bed.
It's using a tanning bed. Yeah. And now I'm paying for it. I just had a severely atypical mole cut out of my arm.
Oh, for real?
Yeah. So I was going to say I'm paying for it now. So, but that's really, just as far as another PSA for
everyone. There, like there's big pharma and big cigarettes and, big, alcohol, like these, conglomerates of entities that, lobby for these things that have understood detrimental effects to public health. Is there such a conglomerate for tanning beds?
I know. I think it's becoming more popular for that. I know at least when I was living in Charleston, that was just something that was being pushed for was like actual like governmental regulation over tanning beds. And I do think it has gotten more strict just in general, as far as tanning beds, like with minors and things like that. But they're still, really popular. They're still around. You still drive around and still see tanning beds here and there. And I still have a lot of patients who still go to the tanning bed. I'm trying to chip away and a little bit at a time, just like, let's cut down, let's harm reduce here. Let's cut down. But I do think it is like kind of addicting for people, honestly, too. Just, especially like if it's cold and like in areas of the country where it's really cold a lot and like dark and like dreary.
Seattle.
Yeah.
Northeast, Northwest.
Yeah. You go to the tanning bed, right? You feel tan, you feel kind of better. It was warm. Like I see why people describe it as addicting. And even just like from me doing it a few times, like I remember being like, oh, like I look so much better with this like tan, And so I see why it appeals to people. It's just, I feel like now that I'm a dermatologist, I really, really try to tell patients like, this is the reasoning. It's not, it's not just like, oh, I don't think you should do it. It's, it's not like it's like a no big deal thing. Like it is like truly a actual, cancer, a huge cancer risk. Right. So from a cancer prevention standpoint, that's one of the biggest things that we can do.
So it's certainly, it is your cigarette. What cigarettes are to me is what tanning beds are to you.
Yeah.
Interesting.
I know.
What was going into dermatology residency like? Was it everything you thought it would be?
Yeah, I think it was. Where I went, and actually I feel like dermatology residencies in general tend to be smaller. So my class there was 4 of us, including me. And that was really nice actually, because we just all grew really close and, I feel like everybody was just like one little family, which was really nice. And then, there's the 3 classes together. So that was really nice. I did feel, I felt like it was like everything I kind of thought it was going to be, which is good. I will say like something that surprised me a little bit more about it, especially coming from internal medicine, ICU. I finished that year of internal medicine in the ICU where I was like so exhausted by the end of that I was like, oh, thank God. Thank God my schedule's changing. And like serious props to everybody who does it all the way through because that is just exhausting. But what I realized is like during that year, the hours are really exhausting and kind of erratic. But for dermatology, your hours are definitely better and more structured. But there's a lot more like outside studying, which I didn't really realize until kind of going in. So even though you may only be in clinic from, where I was, we had didactics every morning. So it was like from 7 to 8, we had a didactic session and then we go to clinic from like 8 to 5. But then you had, at least like reading or questions or something that you needed to do usually took, a couple hours kind of thing. So, a couple hours a night to kind of do that or, trying to kind of bulk things together some other night. So there's just a lot more of like that kind of studying, which was interesting to me and something I just didn't really realize. And then also when I was in residency, the boards actually changed for us. like, I guess, yeah, it was during my first year it changed. So it used to be where they had all of the boards kind of at the end of residency, which is how most boards are, like right at the end, and in kind of a long process. So they actually divided them up where 4 of the boards were taken during residency of the board test. And then you had to, pass those to then sit for the final boards after residency. So the nice part was that after residency, the final boards was not as long as it used to be. And it was not, you didn't have to go fly somewhere to do it like they had did before. And so it was kind of broken up more, which I think actually was good. Like, even though at the time it's just a lot more pressure. Like, I just feel like, in general, I feel like residency is just like a lot of pressure. And especially where I was too, it's just a lot of like, you need to know this. And if you don't know this person's going to know it and is going to show you up, but, we just had a lot of studying. And I think that was something, obviously I knew there was gonna be a lot of studying, but the day-to-day studying, that part was a little bit different. So I just ended up being, tired from kind of a different reason.
Right.
So I do tell people, like, if you're just going to dermatology for like lifestyle benefits, even though the lifestyle is really great, especially when you get out of residency, it's, there's still a lot of, in residency and things like that, it's still not as great of a lifestyle.
It's still
kind of
training.
Front.
It's still training. Yeah.
It's still training.
Yeah. And we've spoken about this a few times on this podcast. I think residency needs to be challenging, right? So you want when you're seeing patients that you are confident in your training and your knowledge and your expertise. And so residency and fellowship by extension needs to be challenging. I think one of my mentors, his mentor had told him that you shouldn't see something outside of training that you've never seen before.
Yeah.
Of course, that's very, very difficult because,
but it makes sense.
Yeah. So you should be exposed to the vast majority of things you're going to actually experience in practice.
I totally agree. And I do feel like I'm so grateful actually that as doctors, we have to do residency or, fellowship if you choose to do that. Because I do think it would be really hard, especially for some other medical positions like nurse practitioners or PAs that try to go into certain specialties. Like, a lot of times there's not a lot of like training background like in those specific specialties. So I do feel really, really grateful that we have that, because you're right. Like, by the end of residency, I felt so confident in everything. And, it just, that way you go out on your own and you're not second guessing yourself or anything like that. So I think it was definitely, it's definitely worth it for everybody. And kind of like a necessary step for everybody.
Did you entertain fellowship, sub-fellowship?
I did. So going into it, I thought maybe I might want to do a Mohs micrographic surgery fellowship. I was talking about like the Dr. Pimple fellowship. But when I started doing it, I realized, even though I really liked doing skin cancer surgeries, I didn't realize, I guess at the time before that you kind of have to give up a lot of general dermatology to do that, because that's really what they're doing kind of all day, every day. So I liked it, but not enough to give up everything else. Because again, my whole thing too was that I really like the variety in what dermatologists do, and rather than doing kind of the same thing, all day, every day. So I started out maybe thinking that. Then at some point too, I thought maybe a medical derm oncology fellowship, which there are not a ton of in the country, but there's kind of a few here and there. And that's more kind of geared towards more like academic centers, cutaneous T-cell lymphoma, that kind of thing, or like really like complex medical dermatology, hospital dermatology with kind of cancer components. So I thought about that briefly too, but then ultimately I realized like what I really enjoy more than anything is just like the whole package. Like, obviously I enjoy the dermatology aspect of it, but the talking to patients and like I was saying, like getting to know about them and just like having this personal connection to them was really nice. And I do feel like too, like dermatology is generally like a very happy specialty, which, maybe a little different from the ICU. I don't know. But, I really like that part of it, that generally we're not giving very, very bad news that often, which I think for my personality is was a little bit more kind of in line. So ultimately I decided, okay, I want to do general dermatology. Like that's what I want to do. I want to see the kids to the elderly, and I want to do just these, a lot of different topics of dermatology and kind of see it all and do it all. And then private practice has been really great too, because that was an avenue that I could kind of go into too, where, can kind of have your own schedule and have control over a lot of things that I may not have had control over elsewhere.
What was that transition like from trainee, resident to your own attending?
I know, it was weird. I feel like the first patient that I went in, actually, I still see her. She's like, I remember I was your first patient. I went in, she was like, when did you start? I was like 5 minutes ago. She was like, really? I'm like, yeah. So it was weird. It was a weird transition, especially when you're so used to, coming up with all of it yourself, but then going over it with somebody else, like going over it with the attending. This is what I think this. And they are like, yeah, or like, maybe we should do this instead. And kind of learning from a lot of different people. And I do feel like, I wonder if you felt this too, as a trainee, you get influenced by so many different people, like your colleagues, but also your, like the attendings there. Absolutely. And things like that. And so there's so many different practice styles and so many ways to do things, because a lot of medicine is not necessarily algorithmic, right? Like there's like an art to medicine. So there's a lot of different ways to do things, and then realizing like, okay, I don't have to do it the way that this doctor did it or this doctor, but I kind of like the combo of this doctor and this doctor Absolutely. Together. And this is actually how I want to do it. And then kind of creating like your own brand from that a little bit. So that was a fun part, I think.
I 100% agree with you. I think once you get the actual knowledge and the actual techniques, that are associated with your field, a lot of it is a manifestation, especially how you interact with the patients, the decisions you make based on the information that you have is based on your own personality, who has influenced you. And I agree. Oftentimes on a day-to-day basis, I can hear my attendings' voices or my colleagues' influence in the decisions that I'm making, and I think that's a really, really cool thing. In football, we talk about, I didn't play football, American football.
Yeah.
I don't know if you ever heard of like a coaching tree.
Okay, yeah.
So if a coach has like these assistants, and those assistants become their own head coaches, and then they have their assistants. Yeah. I feel the same way with medicine, like I wonder how much of what I know has been passed down through the generations of doctors.
For sure, yeah.
And I think that's so cool. You're carrying on. I'm probably carrying on someone's knowledge, experience, art of medicine that I've probably never met before.
Right,
and
exactly.
I think that's really,
kind of
really
up
cool.
the tree even more. I know, it is. It is cool.
Private practice versus academic.
Yeah.
Why that? Why did you make that choice?
Yeah. So I really liked teaching, and I still like teaching a lot. So I knew if I went academic, that could be kind of a nice benefit of that, that you get to be around students or, residents, and kind of teach more. But at the same time, I also knew with private practice that, I would have a little bit more control over my schedule, and just kind of a little bit more control over like the day-to-day. And then knowing too that, eventually you can become a partner in a private practice, where there's a little bit more of the business side too, which I was interested in as well. And I just kind of realized that, the private practice kind of route was probably for me. And I do think now looking back on it too, for 2 years, that I think I made the right decision, that I like having that control. And I will say too, when I first came out the first year, I was doing where I was at my private practice, but one day a week, I actually went to a hospital in Bogalusa, Louisiana to do rural dermatology, because they didn't have a dermatologist in that entire area. And so I went to Our Lady of Angels over there just once a week to do it. And that was really, really great. And I loved all my patients there. But I kind of got a little bit of a dose of like academic medicine. And so that also was kind of helpful at realizing, okay, like I really, it was really great for that 1 year. But I realized that ultimately I wanted to be just kind of fully kind of into private practice, being able to practice how I want to practice and maybe not necessarily how a hospital administrator would want me to practice. Which I feel like is always the age-old struggle with the structure. Combine those, struggle with the structure of the American healthcare system.
Yeah.
So I know. I mean, have you kind of felt the same a little bit as far as like, or have you struggled with that at all as far as like how you want to practice versus maybe how other people want you to practice? And kind of balancing that.
Yeah, absolutely. I think, especially when it comes to the art, because often the other thing about the art of medicine is that the different arts actually don't make that much of a difference in terms of a patient's quality of medical, I guess, the medical care that's being provided. So the art just means something to the provider.
Right.
How they practice medicine means something to the provider.
Right.
As opposed to
outcome's the same.
Exactly.
Yeah.
The outcome is the same.
Right.
And to me, when I look at it from that perspective, if the outcome is the same and it means a lot to me that I do it this way, then I should be allowed to do it this way.
Yeah, that makes sense.
You see what I'm saying? So as long as you're not out here doing, things that aren't evidence-based or go against the grain of practice, the grain of knowledge, etc., that is harmful to the patient. I think within reason, you should be allowed to kind of express yourself in how you practice.
Yeah.
Obviously, if you have bosses, you have to listen to your bosses, and it comes with the territory. You kind of sign up for that structure, like you said. You sign up for that structure, and it's part of the push and pull. But for the most part, I work at an excellent hospital. I work at Terrebonne, and we have a tremendous support system there. They take really good care of us, and they're very mindful about our own individualities and how we practice. So it's been a really, really, I think one of my favorite things about being an attending is kind of finding myself, finding my way of providing. And I think that, and I'm still doing it. I think on a month by month basis, I shift something a little bit this way, a little bit that way. I do something a little bit different. So I'm still kind of figuring myself out in that sense.
Yeah, I think same here. And it is interesting, you're right, like to see the way other people do things too, which is also why I really have loved being in the group that I'm in, because I'll see a follow-up patient of somebody that, one of the other dermatologists saw or nurse practitioners saw, and just kind of see how they approach something. And maybe it was a little bit different than what I would have done. But like you said, like outcomes all the same.
Yeah.
And it's just kind of an interesting thing. And I agree. It's like you're just constantly kind of pulling from other people until you kind of get your own flavor.
Right.
Yeah.
And that flavor can change.
Right.
That flavor can change on a day-to-day, month-to-month, year-to-year basis.
Yeah. It's interesting.
How has motherhood been for you? It's only been 5 months.
It's been great. I love being a mom. That was always, I feel like, my biggest life goal. Like, yes, my life goal was to go to medical school. And then after that was, obviously to actually graduate and be a doctor. And then after that was to be a dermatologist. So that became my goals. But from the beginning, it was always to be a mom too. So I was like, I knew that was always kind of hopefully part of the plan. But it was definitely a little bit of a journey. So we did some fertility things, ended up taking a lot longer than we thought it was going to take. Didn't really know a lot about infertility before all this and I will say, like, I do feel like now being on the other side that there's a lot of people that do a lot of fertility things that, you don't really hear about, or, especially in medicine too. Like there's a lot of women that, get this like infertility diagnosis. I think my fertility doctor told me is like 1 in 3 female physicians will have some sort of like infertility at some point. And he was saying like, they don't know if it's just like the stress of certain things, the training, or what, but I thought it was interesting. And so I definitely did not realize how common it was, I feel like, until then. But I do feel like even that process like strengthened my just like want and desire to be a mom. And so it just made it like even more sweeter that when I did get pregnant. And then now that I have Olivia, my little baby, who's great, that it just kind of shifted a lot of perspective for me too, that like family life to me, is always like the number one, like it's always going to come first kind of thing.
How much have you changed in the last 5 months? Or really, to be fair, it's the last 14 months. How much have you changed, and what has surprised you the most about being a mom, and specifically being Olivia's mom?
Yeah. Oh man. I don't know. I think I think just my perspective has changed the most. Things and like my priorities have changed the most. Like things where I thought certain things were like so important. Just like little things, but it's just when it becomes part of your everyday, you're like, this is so important to me, and I can't believe this is happening this way, not this way. And then I had Olivia, and it's like, oh, that's fine. Like, whatever's fine. So maybe I've been more like go with the flow after. And I think, what surprised me the most, honestly, I think what surprised me the most is that I could love something more than my dog. So that was one thing. Because like people said, they're like, yeah, you're going to love her more than, your dog. And my husband and I were both like, well, we love our dog. Like there's no way, And then she came out. I'm like, oh, I see it. I see it now, and just felt like she's the number one. And I feel like too, like with my husband too, seeing him evolve into a dad also surprised me in like the best way. Cause I knew he was always going to be a good dad, but just seeing how he kind of like rose to the occasion. And I feel like it just like our relationship changed in a really good way.
Right.
Too, which is nice,
What does the future hold for Dr. Karlin?
Oh man. I think, I'll say for the near future, I'm still going to be at my group private practice over in Covington, Sony Dermatology.
I was about to ask you, what's the name? We didn't even give the plug.
Sony Dermatology and Aesthetics. And they're great. The 2 owners are married, and they are dermatologists as well. They're actually like med derm, but internal medicine and dermatology. They did the combined med derm program.
Wow.
But they're great. And, family is really important to them too. They have 4 kids. So it's just a good environment in general. Really like being there. So we'll be there, hopefully forever, but, always life, right? But as of right now, that's the plan. I am also more recently now a social media correspondent for the American Academy of Dermatology too, which is exciting. So a lot of social media videos and promo things with them. That's been exciting. But that's about it. We're just kind of seeing where life takes us and kind of seeing what doors open as we go, going from there.
We're going to tag Sony. How do you say it? Sony?
Sony Dermatology.
Sony Dermatology. We're going to tag them to the description of the video.
Perfect.
We'll tag your Instagram and social media stuff to that as well.
Perfect.
How have you been enjoying that aspect, the social media correspondence, if you will?
Yeah, it's been really good. I just started this role in May, so it's fairly new, but before that, I was a social media ambassador for them, which was just a little bit different, but kind of got my feet wet a little bit. But it's been good. And the whole program, or like the whole reason that they started the American Academy of Dermatology, or the AAD for short, ended up bringing in these social media correspondents, was to help educate the public on exactly things they're talking about. Like, what do dermatologists actually do? And like, when should you go see a dermatologist? Just common myth busting videos and things like that. So that's been really fun actually to make and kind of brainstorm with the other correspondents. It's been a lot of fun. So I am excited for that. That's a good next few steps, which will be good.
Would you ever do something like this, a podcast or something like that?
I know, this has been fun. Well,
Right?
now I see the setup. I'm like, man, this is great. This has been a lot of fun. I know. I mean, we'll see. We'll see where things take me. I'm definitely open to a lot of opportunities. And I actually think that has been one of kind of the nice things too, maybe kind of going back a little bit to the infertility things, is just kind of realizing that paths can change. Things can change and things may not go the way that we see them in our head. Because really up to that point, everything, I was really fortunate in that things had really happened the way that I had planned and, with hard work, obviously, but, I was able to do I was able to accomplish the goals that I wanted to accomplish in the time frame that I set for myself. And in the order that I wanted to do things. And then that came in and it's just realizing that there's certain things that we just have no control over.
Absolutely.
And you just kind of have to like sit back and just let things ride. So I do think like going forward and just future and thinking about next steps, like I've kind of just have continued to apply that yes, like I'm going to continue to work hard and, make opportunities for myself. But at the same time, there are some things that we can't control and some things that will just kind of come on their own.
Well said. Dr. Karlin, Dr. Samantha Karlin. It's a great pleasure. Thanks for stopping by.
Yeah, thanks, Hugo.
That's it.
Oh,
that
was fun. Thank you.
Thank you.
This was so fun. I love it.
Thank you so much for watching this episode of The Last Zebra. As always, please don't forget to like, subscribe, share, and comment. We have new episodes that come out every Tuesday on all of your podcast platforms and on YouTube. I'm looking forward to seeing you guys on the next one.